The first technique is more or less the myofascial meld, where I've now been able to locate, and again, it's deep, and that's what our intention is, and I'm just going to hang out, and I'm going to apply some just gradual pressure, and I'm going to hang out. My technical term of just waiting for a release is hanging out. And I feel a little bit of a release. We'll increase the pressure. You probably won't see much of movement because a lot of times there isn't. And that's the first one, so that's the myofascial meld. Okay, so now for this one, again, I'm going to be locking in, but the action is all going to come from the client. So Sean, if you can bring your knee up towards your chest. Good. And now straighten the leg down. Ongoing. Here we get a bit of tightness and bring it back up again. And as the slack is coming off, I'm going to increase my pressure a bit. And back down. And this time a little different is I'm going to give it a bit of a superior drag. And back up and we'll relax. And just relax. Now I'm just going to hang out for a bit. Any pain or discomfort? Good. I've found my rectus femoris. So this one is going to be more of a direct, and it's a simple thumb stripping. Any pain or discomfort? Okay. And take it as high as we can. Remember, we got to respect the drape. And again, I'm going to start right at the superior pole of the patella, almost on the pretty much on the quadriceps tendon. And again, I'm going to use my elbow. Depending on your client and their pain tolerance, you can increase or you may have to decrease your pressure. So the next one, now that we've done that, is I'm going to ask Sean if he can straighten the leg out. And now we're going to, as I move up, we'll just have him relax and take it down. I'll bring it up, take it down. Bring it up, take it down. All the way through. This time we're going to make it more of a direct and active. So Sean, if you can extend and let it down. So my pressure movement as it goes down and back up. And down. Good. And relax. So now that we've done rectus femoris, we're now going to move on to the lateral side. Again, straighten the leg out. And we can see, and I can palpate now, vastus lateralis. Again, I'll start off with a bit of a thumb. And again, if you're using lotion, this would be a stripping. And since he was good with that, I'll now bring in the elbow. And Sean, you just let me know if the pain is, if you have too much pain, just let me know. So now, Sean, if you can straighten the leg out and let it down. Good. Straighten it up and let it down. Good. And up. Tight. And then as it goes down. Good. Keep going. Good. One more time. Down. And again, you can use the elbow if you want to. Now this time what I'm going to do, if you can straighten the leg out, find vastus medialis obliquus and relax. And I'm just going to use my thumb again and again, be respectful of the draping. And I can also bring in the elbow. Okay, and again, as we did before, if you can straighten the leg out, Sean, good, and let it down. And up, down, up, good, up, down. So a couple of different ways when we do this technique. You can continue your movement along, or you can do your movement in that direction when the knee is bending down. more, so straighten that leg out again. I like doing this, it's good for helping landmarks, and with Sean, we're lucky he's got good definition here. Relax. And separate the two. And go again one more time. Again, if I want to, I can use the thumb. Any pain or discomfort? No. Excellent. Okay, so this time, Sean, if you can straighten the leg and let it down. Straighten, let it down. Okay. Now, one of the other things you can do a more indirect way is to just place your hands over the entire body. And what I call, again, hanging out. This is the myofascial meld. And kind of sink in a bit. And just to see how tight things are, see if you can do a bit of a medial rotation, just very gently. And keep on going. So I'm going pretty good here. And I'll take it as far as I can until I start to see the big toe turn in. So as soon as the toe turns in, I'm going to back off. I'm just going to hang out. And now I can take it and I'm going a little further. And we get movement again, so I'll back off again. And we can go the other way. And as soon as I start to see the toe move out, I'll hang out again. This is more of the myofascial meld. And another way, very common, is cross arm. This is another variation of the myofascial meld. So as you can see, there is more than one way to work the fascia. The other thing you can do, again too, with all of this is if I want to grab on to the quads as a whole, Sean, if you can straighten the leg out, and now just let it go down. Okay, let's do that again. So now I have what's known as the myofascial lock, so straight up, and increase the squeeze, and again, and back down. So this time, again, as it goes down, I'm dragging everything superiorly. And again, straight up, and I'm dragging everything superiorly. And one more time. Good. Okay, so now what we're going to do is I'm going to separate. A lot of times when Psoas lateralis is shortened or tight, you also get that with your iliotibial band. So all I'm going to do is just a simple pass with my thumb. This is a direct method in between the Psoas lateralis. You may even need, for me in this case, need reinforcement. John, you just let me know if you want me to back off on the pressure. And again, this can be a very sensitive area, so you want to make sure you're in consistent communication. How are you feeling there, okay? Any pain or discomfort? Nope. Okay, so as I go, if I want, I can now get my knuckles in there as well too. Again, this is direct. The client's not doing any work whatsoever. And you want to get in between the iliotibial band and the Psoas lateralis. Now, if he's comfortable with that, again, if you can straighten out the leg, I like to do this for my landmarking. There's Psoas lateralis. There's the IT band. I'm going to get in with my elbow. Maybe what I'll do is just a little bit of a medial rotation here to get in. And again, any pain or discomfort? No. Good work. Okay, so now that we're here, we can also work the iliotibial band. And we'll come back to some other techniques separating the two. Again, I like to find where that tendon is. And I'm just, again, using my thumb, we'll just turn the leg in a bit. I'm just going to strum right along that tendon. Any pain or discomfort? No. Now, we like to protect our fingers and our thumbs, so we can also reinforce. And you definitely can feel that. So again, if you can straighten up the leg for me. So IT band, vastus lateralis. This time, Sean, again, as you've done before, if you can straighten the leg for me. Good. And let it down. And up. And down. And up. So it's tight here. Good. So I can stop, or I can do a continuous pass as he is flexing and extending at the knee. And again, if I want, in between, use the knuckles, reinforce. You just let me know you need me to back off on the pressure. And one last time, again, straighten the leg out. Again, landmark. Here we go, here we go. And again, Sean, if you can flex and extend. As you can see, I am getting my elbow right underneath the vastus lateralis and right over top of it. Okay, so now we're going to show you a couple different ways you can work the IT band. Again, other variations if you're not got a client under the sheets, but for our purposes, again, this is more of a direct. I am going to start just by the knee, and I'm going to work my way down. This is a direct method. And now I'm going to do a direct method with passive action from the client as I take them into adduction. So now we're going to do tibialis anterior, a couple of different ways we can do that. First way is the direct method, so I'm just going to follow up along the body. We know it's on the lateral side. Again, using the thumb. If you want, you can use your knuckles. I'm not sure if you're going to be able to get in there with your elbow. This time, as I do the pass, I'll ask Sean if you can push the foot down and turn it out. And back again. So we'll have you plantar flex and evert. Down, and if you can go the other way, turn out. Yeah, good. And we'll do that one more time. So down and out. Good, and relax. Any pain or discomfort? No. Okay, so now we can also separate the fibularis muscles or the perineal muscles, that's okay. So what I'm going to do is just going to have them slightly turn, so it's on the side. And Sean, if you could just turn your foot out for me. And if we can keep, let's turn that leg back in along the side. So this time, I'm going to start right here at the lateral malleolus, and I'm just going to strum my thumb up, and I'm going to separate and go in between the two muscles. Any pain or discomfort, Sean? No. Again, if I want, I can use the knuckles. And this time, Sean, as I'm going up, if you could turn your foot in for me. Good. And bring it back. And turn it in. And one more time. Let's do one more time. Oh, turn in. And relax. So now what I'm going to do is I'm going to show you how to separate the interosseous membrane, which it runs in between the tibia and the bone on the outside here, the fibula. Let's see what happens when we... Oh, good. So we find medial malleolus, lateral malleolus, find point in between, and all I'm going to do is run my thumb right up the middle. Any pain or discomfort?
No.
Good. Okay, this time, Sean, if you could just move the foot up and down from the ankle as I do this. So again, dorsine plantar flexion. And then if what I like to do, if I can do it, I can do it passively as well too. And I'll actually straighten it out a bit. There we go. Any pain or discomfort?
No.
And just relax.